Going on, you guys? Welcome to another episode of the Gabriel Show. Guys, check it out. We're getting ready to go to the plantation. And honestly, man, I just want to give you guys a little bit of quick game, all right? Any ICU nurses out there, if you're new, listen up, okay? Now, when you get to the job, all right, I want you to get your report sheet, all right? First and foremost, get there on time. Next, get your report sheet and just take report, all right? Don't ask no crazy questions, all right? I mean, unless you feel like you can't find that answer yourself, don't ask it, man. That nurse wants to go home, all right? And a lot of times we be asking questions that's not even necessary. What's the patient's name again? Bro, patient's in room 8, bro. That's all you need to know, all right? I'm joking. You do need to know the name. But you know what I mean. There's some questions you can find out yourself. I mean, unless they have it in front of you, like let's say you want to know certain lab values, you could ask like, what's the BUN, what's the creatinine, what's the hemoglobin again? Okay, those questions, fine, because you need to know that just for your day. But as long as you know that labs were drawn, cool, you know what I mean? Just make it, I'm not gonna say make it easy for that nurse who's leaving. If they're trying to give you like a crappy report, slow them down. But if they're telling you everything, no need to stop them every 5 seconds. Let them talk, listen, and if you don't get what you need out of the report, then ask them questions, okay, if you must. Now, before that nurse leaves, ask that nurse, hey, me and you, let's get up and look at the patient. You have a quick second? Get up with the nurse and go do a live check. Everything they told you, right, you got to validate it. Is this patient actually alert? Does this patient actually have a gag? You know what I mean? Are they actually, you know what I mean, stable? So go into the room with the nurse, with the outgoing nurse, you're the incoming nurse. If the patient's intubated, really quickly just check their pupils, you know, make sure that they had that perla, all right? I'm not gonna, if you don't know what perla means, man, look up perla C. But you wanna make sure that their pupils are equal and reactive. The next thing you wanna do is make sure they have a cough and a gag, all right? Because they said they did. Next thing you know, by the time the nurse leaves, you check for a cough and a gag, this guy's brain dead. Right? So that's one thing you want to do, stimulate your patient, make sure that exactly what that nurse said is exactly what it is, okay? Now, let that nurse go. You don't have to OD, you know, but it depends on the surgery, all right? If they had a abdominal surgery and they're talking about there's bowel sounds, maybe really quickly you could just listen to if there's bowel sounds in front of that nurse. But you don't have to keep them there. You're just trying to validate what they said. Now, guys, when you get back on the floor and you're by yourself, okay, and you're doing your head-to-toe assessment, guys, listen to what I said, head-to-toe. All right, you got to check out every follicle, all right? At least do it once. I'm not telling you to do that every hour. But when you do that first initial assessment, do a head-to-toe assessment. You got me? Okay? From the toe cracks in between the toes, the fundus, all that. But I need you in there, okay? And most importantly, make sure you have a working IV. All right, I'm not going to tell you the unnecessary stuff, but make sure you have a working IV and make sure you have 2 IVs at all times, especially in ICU, because check it out. You need 1 IV specifically for fluids. Let's say they're coding a patient and they need volume, right? 1 IV is going to be for fluids and the next IV is going to be for medications. It could be any medication, right? It could be epi, it could be bicarb, adenosine, whatever the case may be. You want to make sure you have 2 working IVs with blood return, all right? Now, if you have a central line, make sure you check those too, okay? Check them central lines and make sure you're getting blood return. You should always get blood return from a central line, all right? That thing's going into the superior vena cava and all that, all right? So there needs to be blood there. If not, get an order. You probably need some cath flow. Clear that out. Make sure it's good. Make sure that check the recent chest x-rays. Make sure everything's in place. If you have a patient who has a peg tube, make sure that's working. Make sure you auscultate, all right? Yeah, auscultate? Yeah, do that. Do all that, all right? Auscultate, check for pulses. Make sure that, and listen, if you check the distal pulses, you don't have to check all the other pulses. Because if the patient have pulses distally, I mean, obviously they're gonna have pulses everywhere else. So distally means, I don't know if I'm saying this right, all right? I'm not Florence Nightingale. I'm just trying to help you guys out really quickly. But As long as they have pulses, pedal pulses, you should know that they have popliteal pulses because it's further away from the body. Okay, check everything. If they're female, you gotta check all their privates. If they're male, check all their privates. Make sure they ain't got no sores. Especially, you know them condom caps they be putting on? They be having sores underneath their penis. So look, make sure, you know, everything's good. They ain't got no rash. Make sure they don't need no nice statin powder. You feel me? Now, some things, if you don't know what I just said, Google it. All right, Google it. Don't ask me to explain it again. All right, I'm just trying to help you out really quickly. And most importantly, turn them around, check their sacrum, make sure they don't have a bed sore. Okay, guys, this is vital to do because, yeah, we could talk about grinding, we could talk about getting to the bag and all this, but if you ever know how to be a decent nurse, this is just being decent. I'm not even talking about the actual care that you got to do, the emotional care, you know, talking to a patient, although they're sedated, you know, you could still talk to them. I had patients who woke up from sedation, and I mean, you know, some of them would be like, nah, I was sedated. But in my heart, I feel like they can all hear. So just keep talking to your patients, all right? But this is just a little bit of game to help you on your journey. It's not just about, yeah, let's get to the bag, let's get the money, let's get this, let's get that. No, we got to actually strive to be better nurses every day, all right? Because I'm telling you, what we're doing is very important. It's very important. Yeah, we need the money, you know what I mean, to do what we got to do for our families and our own personal goals. But more importantly, we can't forget our nurses pledge, all right? I done stood up there and said all them nursing pledge with Florence Nightingale and all that. So we got to stay true to the game, all right? But anyways, guys, that's just a little bit of game I have for you. So if you're a new ICU nurse, I believe that will help you guys, all right? These are little tips I learned throughout the years. You know, we've been in the game for a long time now, and I just want to help you guys out because I know a lot of people is just going right into the ICU as soon as they graduate, okay? My greatest advice is, yo, go to med surg first, or at least step down, you know, get your experience, because once you get to the ICU, man, these other nurses is expecting you to have some type of experience. You could be a new grad too, but you're going to have to be on your P's and Q's, man. You're going to have to go home and do your own studying. You know, the reason why I even make these videos and talk about my job and stuff like that, because I'm not going to lie to you, when it comes to my nursing game, I'm cocky with it. All right, my coworkers, they know I'm not trying to sound arrogant. But when it comes to what's going on, all right, I know what's going on. But that's how you guys had to be, you know what I mean? And it's not, I don't even mind being cocky with it because I'm not going around talking about I'm the best. But I just know that I'm going to deliver the best care possible, all right? I want all the awards from patient experience, you feel me? And it's not just about your nursing care, it's about your attitude. It's about how you treat the patient, how you treat the patient's families. There's a lot to it, guys. And I'm going to give you guys all my little secrets because, yeah, we're grinding, but you know, we got to be smart about it too, man. We got to be smart. But another thing I want to show you guys is the hustle, okay? I want to show you the hustle. I want to show you the grit. I've been dropping content every day, maybe twice a day. I don't know. But I have no excuse. Some days I'm happy. Some days I'm sad. Some days I'm in between. I don't know, bro. I'm not going to stop. I have no excuse for you. I'm going to show up. I don't care if I have to show up in the bathroom. I'm going to show up. All right? So that's how I want you to be about your goals. If you say that you want to lose weight, go to the gym. Show up. You know, if you say that you want to start a YouTube channel, drop that content. Do what you got to do. There's no excuse. I don't want to hear it. You know, and I know sometimes I feel like I'm going through it. Yo, there's somebody who's going through it even worse. All right? My wife was telling me how one of her coworkers freaking lost her dad, got separated from her husband, failed out of nursing school, all in 1 week. All right, and sometimes we be complaining about things. That's first world problems. Okay, so guys, listen. If you have life, if your vitals are stable, get ready to grind, get ready to hustle, stay prayed up, and also just know somebody have it worse. All right, somebody have it worse. But that's my little game for today. I got to get going. I love and appreciate you guys. Peace.